Stress fractures can be a real problem. First of all, the word stress. For some reason, I think the average person hears that word and thinks that it's really not a fracture. Well, sorry folks, a stress fracture is a real fracture. In general, fractures take 4 to 6 weeks to heal. While stress fractures can occur in any bone in the foot, the most common stress fracture that people experience is in one of the metatarsals in the front of the foot. The second problem is the symptoms that people experience are really subtle. Their pain isn't, but the rest of the findings are really fairly hard to detect. For us, that's not so hard. The most obvious thing that you can see with a stress fracture, besides having pain, is a slight puffy swelling on the top of your foot, just at the base of your toes, over the metatarsals. The pain is localized over usually one metatarsal. The next part of this is that when we go to diagnose this problem, I think it's hard for the patient to have confidence in the answer because it's just a little puffy swelling. And in the early part of the problem, particularly during the first 3 weeks after someone has the onset of pain, you virtually see nothing on an x-ray. Now, in that early period of time, an MRI exam could be run, and that would confirm it, but clinically, we are able to diagnose this most 95% of the time with great accuracy, that localized pain over the top of one of your metatarsals with slight puffy swelling is a stress fracture. The last part that's hard to understand is that oftentimes there's absolutely no injury. Now, if you look this up online, you'll find that it says it's associated with running and all these other activities. But I will tell you, I have many patients who are not runners who develop stress fractures. It's not necessarily a sign of many other systemic problems, but it can occur, it's localized, and it needs to be treated. Walking on it will continue it, exercising needs to be avoided, and the foot really should be treated as if it has a real fracture. That means usually immobilizing it in a cast is the easiest thing, a walking cast. You can walk on it. Now, the last part. For some reason, they're stubborn. I think in part that's people's unwillingness to say, I have a fracture, I need to wear a boot, maybe even I need crutches and I need to stay off it. When these aren't healing in 4 to 6 weeks, sometimes we do run an MRI. Sometimes that's just to tell both of us that there really is a fracture there and it needs to be treated aggressively. So if you've got pain at the top of your foot with sudden onset, localized in one area with just slight puffy swelling, or you don't see much of anything, you might want to come in. Let us take a look and establish the diagnosis.